Tuo jonyo. Tuo ge malet matika neko dano milion mapol ituo kwilobolo. Yo menongo yat machao tuo man fudo ngai wawang wilobolo. Itumpa mwa alibario kipiera rio. Kibiao ni dano maramo milion pierdeku ya biero tona bichil. Ono gitiki tuo jonyo hiwi lobokolo. Ikom Wilman, dano madonyo ludiro tie milion pierdeku ya bich tona bungwen. Kalotien mako chaka para bichi dokwede piny tie milion achil tona biro. Pol pa jomagi wengi ti sub-Saharan Africa kama Uganda benatiye. Man ayodo do pa Uganda malupe kilokom tuo jonyo maakibot Dr. Nelson Musoba adit maloyo dul me Uganda AIDS Commission.
The prevalence of HIV from the 2017 survey is 6.2. We have an ongoing survey now and led by the Minister of Health. COVID delayed it a bit, so we will get a new result, but the current one is 6.2. We have an estimated 1.4 million Ugandans who are living with HIV. By end of 2020, we had 38,000 new HIV infections, because every year we see it, we assess, we work with experts, Minister of Health, UNAIDS, and come with estimates. So 38,000 new infections in a year. We had about 22,000 deaths that were directly attributed to AIDS, Many of those are either on treatment or default, and then they get the complications of that.
Lagamp ya wene kidong nining matuo mano dono kwere Uganda putpe ya tie biak tie ni kin mwaka alibachele miya bongwen kipiara bor kiwie tuo mamono kerpengene ochako nekodan mapol Irakai district tutuale iwang boda mekasenero.
We are now almost 4 decades, 40 years since we first got reports of HIV and AIDS in Uganda. The earliest cases were reported around 1982 in Rakai, in the landing sites of Kasensero. And at that time there was little understanding of what this new disease was. It was a disease that was causing people to lose weight and have rashes and have multiple other infections.
Tuo man ononotika neko dogai mapatpat dono nenchalo dong pejoke. Churchut kichao tamani man nenchalo titime jok konyo time tiet.
And as you know, African communities usually, when there is a new and strange thing, they go into superstition rather than fact. Because the disease was initially discovered among people who were plying on the lake, conducting trade between Uganda on this side in Rakai and Bukoba in Tanzania across the lake. And there was superstition, is this witchcraft, people have not paid off their dues. In the early days, there was not much in terms of solutions. Luckily enough, our country was fortunate in 1986 when the NRM government took power. The president put a lot of emphasis, as he usually does, on health. And he took a lead on this issue of HIV to make sure that the country addresses it. That time we didn't have many solutions, as I indicated, no drugs, no this, no that. The main focus was on mobilization of the communities for prevention, so that the public knows how this disease spreads and therefore takes precaution to avoid those ways that the disease could get them.
Lanyut patuoman oberumaki liaro matek charo lili ware padelkom kidong jonya romalamal kuno dongatimoni koru chawatone keken ikina nywera man imwaka alibachel miya bongwen kipiara boru ya bongwen dan guchaw hinyo yo menongo yat mechango tuo jonyo maano pekiniai komeni pole dan go berka wot ibo piny karwati kidan manyie yo wanina na nyonga ajua mo atil maono yuek matera tera ilo komi yo yat pitu mapol kidong tuo jonyo kine intuku machie Imawogola district maikareni. Nanyonga unowaini tie kikweyo mo makachinga timono nao. Neko wakwiri tuo jonyo chot. Adada mapol guchako nango kweyo man kini ye mechang ikom tuo jonyo. Jomo kene ukemo yara mara. Onyo yate kwar ento weng obero nono.
It's true that there is a role for herbal medicine. We would like, recently Parliament passed a law for regulation of the herbalists. We would like that law to come into force so that people can come out. Herbalists now, they need to work on the patent law to make sure that they are protected, their product. When they come out, somebody will not come and run off from it. They should work side by side with the modern health professionals so that as you give the drug, you're testing to see is the virus reducing, is the person improving, because the two can mutually benefit each other. You can give a herb and use the science to measure how the herb is working, whether indeed is effective or not.
Ngat mawilobo weng ono kwero dokwora yobela wea chiel Fili Bongole Lutaya. Eno katia tieka wani tikituo jonyo.
In times of God, in times of sorrow, let's take a stand and fight on to.
Lawe Fili oberka jingo chuindano kilo ke bolu tuo kijomo kene manufut pe ya tuo marokim. Eno kwero lok ni mano bero tuo machilo time jok kao moko na nyoli Uganda umerko gwake kawek gulo tuo man kunwaene en bene itika kuo kikwiri tuo jonyo ikarmeno lawe mokene kasozi olubuko Philips kunwaene en bene itika kuo kikwiri tuo jonyo ikarmeno niyotin joario ni tie machalo tera ilokom loeny ikom kwidi tuo jonyo kony pagamente unomite matere karmeno Imwar alibachil miya bongwen Pierre Boru ya bichil kiyaro dul me AIDS control program kidok mokene man Uganda AIDS Commission lubukore imwar alibachil miya bongwen ki Pierre bongwen wiario dulario man ngutiyo kachil kidul mokena peje kom gamente kachil kitaso meluenyi kom tuojo na Uganda kongi kupe kachil kidul moken mapat iyo memiyo kony.
The president was on it from the beginning. This is how the AIDS control program at the Ministry of Health was established in 1986 and the Uganda AIDS Commission also in 1992. But also he went around the country and worked with the various stakeholders, especially religious leaders and the cultural leaders, political leaders. HIV became an agenda item.
Kwena ikom tuo jonyo chako kati iyo mapat meme dongech iwidano. Peote erokar malach anywali Uganda maduong guchako nongo ngech ilokom tuo jonyo. Tutual lok me gwaka kibere mit bere kila chonyo da chile keni winye kidong tiki roj bol uchako ngene kindano.
We began a program called ABC and we have been strengthening ABC so that people can abstain when they are young, especially the young people. But if they are married, that they remain faithful, they be faithful. But if you don't abstain and also not be faithful, at least you use condoms because we know condoms will protect you from exposing yourself to HIV.
ABC worked for us. Remember in the beginning, we did not have drugs. When we started this fight, when the president came out and announced in 1986, I think Ugandan soldiers had been sent to Cuba for training, and 18 out of 60 were found to be HIV positive. That's a prevalence of 30%. There was no treatment. Later on, treatment started becoming available, but it was very expensive, way out of reach of the common people, and also had many side effects. In fact, back then you'd hear that wait for the CD4 count to come down.
Kwa yat mapat bene uchako kati meluenyi kom tuo man. Medo kiyo makeromo makone mejoko nyapa tuo jono weng uchako kati.
The ABC campaign was really helped us to bring the numbers down, A, for abstaining unless it is time, so really discouraging young people who are not yet mature to keep away from sex. B is being faithful to your partner. You have one partner, because one of the risks of new HIV infections is if you have multiple sexual partners. But also C, you may have a partner and maybe it's a discordant partner, or whose HIV status you do not know. Then you use a condom.
Oguloko matek ikompero magino machala duke memonyo yat la jin. Yat onotima duong tutual magen ki muyo ndak muyo bero tek. Chaji kiweli yara munya okelo pero tuale bojo mono peke mero nyote. Iken luak ni kitika kuo kituo jonyo. Mano kelo chiemo tok. Lutuo guchako kalo kenchawa kiniro memonyo yat. Owewa yat ojoko tichi kom lutuo mokene. Kabene tuo chako bero duong ikomge.
Resistance comes when you abuse the drug, when you don't take the right dose, when you change the times, when sometimes you miss and skip, then resistance can easily develop. So the urge to, and we've, come from the time when the medicines were so many, when they had lots of side effects, to, you can take one pill per day, and the side effects are so few. So if you follow instructions of the health professional, the chances of resistance are very low.
Niotin dano matu jono marogin kachil ke maone rogin do chao doping. Man tuero bernia duki mekwed o win kibo dakta kilo ilo kom yo achil manyen megengo nyapa tu jonyo ditwale mamon ayeti ukwere.
Swallowing a daily pill every single day is not easy for everyone, and adherence has become a very great challenge. So we as researchers, we're in the process of seeing how can we bring forth HIV products that best suit one's lifestyle, that one can use and adhere to very well. Because we know that an HIV prevention product, if not used, cannot be effective. So we have what we call the Pavilion vaginal ring. This is an exciting new product. It is inserted into the vagina, and of course it is a female-controlled method. No man can use it. So it's inserted into the vagina, and it is for 1 month, 28 days. So once a woman inserts it, the Pavilion vaginal ring, which is made out of silicone, releases the Pavilion drug slowly over the 28-month period. And when a woman has sex with a man who has HIV, she's actually protected from getting HIV.
Dul malalo komiyot komi wilobo man World Health Organization okero moko me joko ko patu jonyo. Me oe makali bario ki piara dek. Gankal me yot ko me Uganda bene okwanyo la nyut man. Me chako temo meno. Ento la peny bene tieni eni mono buchopa ni ning e Uganda kany.
2030 is a great year. I hope we get there. The way we as researchers are trying to help. One, if you reduce the number of people who get infected, and that's why we're looking at ways to do PrEP. How do you prevent young people and adults from getting HIV? Because if you can prevent them from getting HIV, then you don't need to treat them. They're not infected. The second thing is make sure our babies, our children do not become infected. So we're scaling up mother-to-child transmission. We already know the research. That one we just have to implement. Then those who are HIV infected, they get different infections like TB. We need to improve the treatment of TB. And we've come up with different studies which show if you treat for this way, it's better than treating another way. So all those things feed into the ministry and inform the Ministry of Health how best to take care of people living with HIV, how to make sure not more Ugandans become infected with HIV.
We want by 2030, for instance, to have less than 5,000 new infections in our entire population. We know that there will still be people with HIV because the ones who are alive are on treatment. You can't kill them. In between, if a cure comes and a vaccine, well and good. But knowing how over the last 40 years how we've performed, we don't want to raise the hopes because we still don't have a cure. We do not have a vaccine. But we want people to, if we vigilantly look, we've looked at the projections, if we intervene with the different measures, the ABC, those who are positive keep on treatment, we can close the tap on new infections and only work with those who are positive so that they age well, they take their treatment, they have a good nutrition. We eliminate stigma. So 0, we don't want anybody to die from AIDS-related deaths. We don't want anybody to get a new infection, and we don't want stigma and discrimination. Once we deal with those three, then that situation is defined as ending AIDS as a public health.
The strategy has been the 95-95-95 strategy for testing, to ensure that 95% of people who are living with HIV in Uganda are tested and know their status. And that 95% of people who are HIV positive are on HIV treatment. Those who are positive are on HIV treatment. And that 95% of people who are living with HIV have suppressed virus. Because we know that way, you not only lead a healthy life, but that you also not transmit to others. It's a strategy for health for those that are infected, but also for cutting down transmission to the rest of the population.
Yo achil magikati kwere kombedi aye yo me joko ko pachu ki kom lutino ni ay kom megigi kdwale kare me yajo yup man tie kaneno ni pewmier kinywa latin mo keken matie kituo jonyo maber lo kwet futi kanena dukine kachetio maber.
Very excited about mother-to-child transmission because I've been part of this research since 1997. And we started out with a very simple intervention, a single tablet of nevirapine to the mother at the onset of labor, and then syrup to the baby. And we reduced transmission by 50%, the virus going from mother to baby. But now we've moved even further. All pregnant women are tested. Those who are positive start triple therapy, 3 drugs, to treat themselves using antiretroviral drugs, but also prevent the baby from being infected. These 3 drugs are so powerful that they can reduce the virus in the mother's blood so that the chance of passing to the baby, out of 100, you may only have 2 or even less than 2 out of 100. Meaning that the intervention that was done initially as research, but now the Ministry of Health has taken it on and provided it to the whole of Uganda. So it's not only Mulago. Every pregnant woman who attends antenatal can be tested, whether in Arua, Kotido, Mbale, Kabale, they can be tested for HIV. Those who are positive, they started on treatment, and the baby is monitored to make sure they don't get HIV.
Roughly 1.6 million women were getting pregnant, have been getting pregnant every year. And out of those, roughly 100,000 are HIV positive. We need to make sure that we test every pregnant woman so that those that are HIV positive are started on life-saving treatment of ARVs.
Ludire yo me science tika tij matek menene chok-choki kichako tuchu dana tuja ke yar la jin tuo jonyo. Kache otime, man bi me yuyo ki dano mapol nakiti kuwa kikwirito jona nakitimo na yar la jin ikare man.
The pharmaceutical industry has continued based on research to produce better medicines, more efficacious, with less side effects. There is no vaccine yet. That one I want Ugandans to know, that we do not have a vaccine for HIV. Work is still ongoing. We should remain hopeful. There is no cure, okay? That the current medication only, can destroy the virus, but it still goes and hides in certain organs. It may disappear from the bloodstream and in most of the fluids in the body, but it still goes and hides in places where some of the medicines can't reach. But there is hope. One is that, like you mentioned, there is advanced research on an injectable ARV. It's not 10 years, but currently what is available, and is also being experimented here in Uganda, is that if you take that injection, it could take up to 8 weeks. That is 2 months. That is a great option when it becomes available, because it means that it will save you the trouble of swallowing medicines every day, having to remember, but also the issue of stigma, where, if you're in school, you don't have to, get away, or in a meeting to go and swallow the medicines, or to get away from your spouse in case of family members who don't know. So it's an issue about stigma. It's about, avoiding the inconvenience of swallowing all the time. and it will be a major breakthrough. And as more work gets done, we hope that, a day will come when either there will be a cure or there will be a vaccine and we can break off. But while that happens, the message for us is that we keep vigilant, we keep, ABC message for us those who are negative to remain negative. Go for testing. If you find yourself positive, there is still hope, and we shouldn't stigmatize others, especially those living with HIV, as much as possible.
That injection that we're researching about is called the injectable cabotegravir. It's a 2-monthly injection, so a woman receives every 2 months. So in a year, that is about 6 times. Yes, 6 times, and you're prevented from getting HIV. So we are researching right now here in Muju, but also Bela and Ayavi in Uganda, but also other sites in Kenya, Tanzania, in Kenya, Zimbabwe, Malawi, South Africa, and other non-American sites. We're actually researching to see its effect in both men and women. Recently we had some DSMB results which show that actually the injectable cabotegravir had what we call a high efficacy compared to the oral PrEP, because nowadays whenever you're doing any research, you have to do the research against oral PrEP, which is already a known HIV prevention product. And it was found that the injectable was superior because you have to, you give it once every 2 months, so there's no challenge of adherence.
Yo melwenyi kumtu jono tema Paul ket madakta kelo nywaro kwere kany.
We have the self-testing kit, because previously we only had antibody tests, and these antibody tests, usually the results would take a long time to come. And then now we have gone into antibody antigen tests, which are really the newer tests that are available. We have very many 4th generation tests that are available in Uganda also. So someone can get to know as early as 7 days later, if they've just recently been infected, they can know if they're positive or not. Unlike before, you had to wait for about 3 months to really confirm that you're HIV positive. And of course, we have the tests that actually check for the virus itself. But these ones usually are more expensive and they take a long time. But excitingly, we have the self-test kits. Before, you had to go to a health center to test yourself. But now there actually is HIV self-test kits where you can go to a pharmacy or a clinic or anywhere else, and you can be able to acquire this PrEP kit and test with your spouse at home. And usually these tests take about 20 minutes. You swab, the gums around your mouth, and you're able to know your HIV test status immediately, which is really, I think, a very great innovation in this.
Itute melwenyi kom tuo jonyo, tuo coronavirus joko bino pore kome. Oyiyo wilobo, unegodan mapol, kun bono wegalany matek bod jomane tika kuwe kwiri tuo jonyo, ikar mekilor wako ping, onyo lockdown.
COVID-19, you're right, has really affected us, especially in the middle of the lockdown, because the participants or the clients or the patients could not come to get their medicine at the hospital. There was no transport, borders wouldn't come, taxis wouldn't come, so it was a very, very difficult time. But I must say the Ministry of Health and also the different organizations that take care of people living with HIV came up with innovative ways to take the medicine to the people. Sometimes they just hire border, take the medicine to under that tree number X, or taxi and take the medicine. Or they have cars that belong to the organization and they'd have the health workers go. And they wouldn't go to the home because we have stigma. You park a bit away and then you walk, or the person comes and meets you somewhere. So during the lockdown it was hard. We actually had reduced numbers coming for their medicine. But by the time we had sorted it out, by the second lockdown, the organizations had figured out how to take the medicine to the people who couldn't come. And those who could come found ways to be able to come and get their medication. And right now, the Ministry of Health reports that the majority of people on treatment are getting their treatment despite COVID-19.
Tien nindwa chele dwemi apawi yario. Tien niramo wilobo kolo dier me po kwere iluenyi kom tuo jonyo. Moch me muharman tieni ribe pawilobo. Ribo tich onyo ribo kori.
The global theme, of course, is a reflection of how we should approach the fight against HIV, that it's everyone's contribution. and we have to work together to end the iniquities and to end AIDS and the pandemic. And for Uganda, we know that we have particularly focused on stigma, and we are talking about end stigma, end AIDS, but also end COVID-19, because COVID-19 has kind of disrupted how we were fighting the epidemic. So it's a joint action. It's about ensuring that we are together, we care for each other, looking out for the others, even as we look out for ourselves as individuals.
Man miulu bodano weng meti kachel ilweni kom tuo jonyo. Jok timotok, jok tuo jonyo. Jok tuo COVID-19, jok tuo gemo. Man aye much palobo Uganda ikweme mwakane. Ento tampa Uganda tie kwene ikom joko nyapa tuo jonyo.
This year we shall commemorate the World AIDS Day. The national commemoration will be here in Kampala at Kololo Independence Grounds, and we expect His Excellency the President to be the chief guest. The theme this year is End Stigma, End AIDS, End COVID-19. It will be scientific, so only a few people will be there symbolically, but we will make sure that the media houses take out the message.
Pierre tekni wa juro motok wa med ngechi kom tuo jonyo. Choko chuna ni Uganda me pime kuno wa gwake iyo me buru.
I call upon all Ugandans, to use this day to remember all those who are living with HIV, protect somebody who is close to you, protect them against stigma and discrimination, remind them, love them. HIV is still here with us, and protect yourself so that especially the young people, we can have an HIV-free generation that can contribute to the development of this country.
Pola nyole Uganda tie bulu maumia ko gwaka matek tutwale ekom tuo man.
If we can get a generation that doesn't have HIV, they will worry about other things, they will worry about development, about realizing their dreams.
Tich pa wan weng telo luak, ayeti meneno ni watiyu kachel me joko nyapa tuo jonyo e Uganda kiwilobo weny.